NGOs in India. And that remains our focus, will remain our focus for a long, long time. In fact, in April, we were getting ready to help children return to school after a year of lockdown. But then the second wave of COVID hit with devastating impact on the country. Our thoughts go out to those of you who have been personally impacted by this pandemic. And I know that there are many of us in that situation. With everything going on, we just could not sit idly by. So we began our COVID relief fund about 2 weeks ago, about 2.5 weeks ago. And thanks to you, we have already raised $7 million. We have been able to put together a supply chain to procure necessary products. As of now, oxygen concentrators from China. And the full credit for this goes to Raj Shah and the team, the Goradias, and a tremendous help at the ground level. You will hear from Raj shortly. We have also set up our own distribution system in India. It is being managed by Pratham leadership, 2 board members of India Pratham Educational Foundation, and one of them you will meet today. In addition, we have tremendous help from our ground partner, Piramal Swasthya, which is a major healthcare NGO, and various other NGO relationships. And of course, our deep roots in 10 to 15,000 communities and 7,000 employees will help immeasurably in this endeavor. And by the way, in typical Pratham fashion, where we pride ourselves on measuring everything, Nishant Begal, our head of tech operations, has put together a tracking system for the equipment. He will be talking on the panel as well. So the next hour, you're going to hear how we have deployed those monies and our plans for the immediate future. Thank you once again for joining us. Now, let me introduce the panelists. First, we'll have Dr. Mangala Nurseman. She is the Director of Critical Care at Northwell Health, which is New York State's largest healthcare provider. She was on the front lines when New York went through its COVID surge last year. Second, we will have Raj Shah. And as some of you might know, Raj and his family have been Pratham supporters for the last decade or more, 15 years. And we are privileged to have Raj as a Pratham USA director. And by the way, when not working on Pratham's behalf, he leads MS International, which is a powerhouse in home products based in California. Jalaj Dani is a director of Pratham India, I should say Pratham Education Foundation, and he's a co-owner of Asian Paints. Asian Paints is India's largest paint company. And I understand, Jalaj, that was started in a garage by 4 friends in 1945. So congratulations on what the company has become. And lastly, we'll have Nishant Begal. Nishant has been leading Pratham's digital innovations for the past 4 years. And in that short period, has made Pratham a leader in EdTech and remote learning. Prior to joining Pratham, Nishant was with TCS, with Tata Consultancy Service. So each of our panelists will speak for a few minutes, and then we'll go into a discussion and a Q&A. So let me turn it over first to Dr. Mangala Nurseman. Thank you so much for joining us this morning. And over to you, Doctor.
Thank you for having me. I'm very happy to be here. I fully support what Pratham is trying to do, and in admiration of what you've already been able to accomplish. Just to give you a little background, I have a sense of what is happening there just because of what happened in New York. As you know, a year ago, New York was the first epicenter in the United States that was hit by COVID. And we thought we were so prepared, and we thought we could never be badly hit like Italy was or China, and that the US health system was different and that we would somehow be better. And I think what happened was shocking to all of us. We got hit with this tidal wave of patients, and our hospital saw our system saw 14,000 patients in 2 months. And so it was a
Sorry, we are experiencing some sort of a technical issue. Dr. Mangala, we cannot hear you. Deepak, you're on mute. If you want to unmute yourself, and maybe we can move on to, yeah, Dr. Mangala, are you?
My apologies, got me. Do you have me?
You're back. Okay, great.
Yeah.
Welcome back.
Yes.
What happened? I'm sorry.
No problem.
So I don't think we realized how sick these patients would be. These patients required long lengths of ventilator time. They stayed on ventilators, high flow needed. We weren't prepared for. One of our hospitals, the oxygen system completely froze over, and we were not able to deliver oxygen for a very short period of time. And the amount of panic that we felt in that moment is exponential as to what's happening in India. Our entire hospital was full of patients, every one of which was on high amounts of oxygen, 1,000 patients in each hospital. So the amount of stress and struggle and angst that the people in India, I can only imagine what they're going through. So oxygen supplies, constant, any space, your house, the hospital, anywhere, and make it into a place we can get oxygen out and allows you to deliver high amounts of oxygen. So simple things like that. We created a program where we took care of 2,500 patients at home, provided them with oxygen, antiviral, steroid therapy, basic things at home so we could keep them out of our hospitals and let the hospitals be full of the more sick patients. COVID doesn't just affect your lungs, it affects your heart, it affects your kidneys. These patients needed dialysis. A lot of different are affected, and we need to save those resources for the people who are very sick. So as many people as we can keep out of hospitals by getting them concentrators at home, getting them medications at home, I think the better off things will be. This new strain seems to be very, very contagious. It seems to be transmitted very quickly. And I think India has the perfect storm. It's multi-generational families living under one roof. It's people who are living in crowded conditions, and it's people who for a very long time were not masking and went to some super spreader events that I think took these strains across the country. So I think it's a perfect storm of what could go wrong with COVID, and that's what you're seeing now. So we need to step in. We need to stop the strain from spreading to other areas if we can, and try to keep the people who are not needing the hospital at home as much as possible. So getting these concentrators to these people, getting it to their houses where they can use this is vital and key, and will save a lot of lives if we can get this done. I think the difference between the 5-liter and the 10-liter oxygen concentrators is a question that I'm always asked about. Many of these patients need a lot of oxygen for a couple of weeks, and then things are better. So getting them up to 10 liters will keep them at home and not make them come into the hospital. 5 liters often was not enough oxygen to keep people at home. And we found that out very quickly in the US. So getting the higher concentration of oxygenators, getting them antivirals such as remdesivir, simple treatments such as steroids, really will make a difference and save lives. Getting the education out there that you need to check your oxygen level and not wait until you're on death's door before you come for help is also key. And getting places set up where they can go for help that is not a hospital setting, I think is also going to be key. Field hospitals, other places where they can get concentrators and bring them home, I think will change the course of this disease from here. So when people have oxygen and they have steroids, the prognosis is not so bad for COVID. Even with this highly transmissible strain, they think the mortality is about the same. So I do think that we can change the course of this and save people's lives by getting them these basic treatments that they need that right now they're not able to get. So this initiative is going to be life-saving to many thousands of people if we can get this equipment there.
Thank you very much. We appreciate that. Let me move to Raj. And Raj obviously has been working very hard, he and his team, on procuring the oxygen concentrators in China. And thank you for all you're doing, Raj, and over to you.
Thank you, Deepak, and thank you, Dr. Mangala, for your remarks. First of all, I wanted to wish everyone on the phone call, I hope your health and well-being and that of your families is okay during these times. So to start, although it seems like a lifetime ago for those of us on the phone and the frontline workers in India, it was really only about 2 weeks ago, maybe 2.5 weeks ago, that the news started coming out of India. And luckily, Pratham has a team that spans India, both rural and urban areas. And so we were able to quickly get real-time news and real-time data and facts, as Pratham always does. And unfortunately, the situation was just as dire and tragic as the media made it out to be. So with this data and news from real-time frontline workers at Pratham, we were able to quickly put together a task force here in the US of a lot of our board members and national people across the nation to figure out how best to serve this problem in India. And based on initial discussions with medical staff, it turned out oxygen was literally the #1 issue and the issue of the day. So our task force just quickly figured out how could Pratham use its resources best to procure and distribute oxygen within India. And just to spend a minute, there's really 2 sources of oxygen. You can either build a plant and allow people to bring cylinders and fill up the cylinders and take it to hospitals, or you can provide oxygen concentrators. And I think both work well. The unfortunate thing with the oxygen plants is, 1, they're expensive. Number 2, they take a lot longer to set up. And number 3, the hospital infrastructure at the smaller and rural hospitals aren't necessarily set up for oxygen plants. So we quickly moved our focus to oxygen concentrators. The great thing about these oxygen concentrators is they're mobile. They require a lot less infrastructure. They can be used in hospitals, at home, and even mobile settings. I'm sure you're hearing news of patients being served in automobiles, and oxygen concentrators can work there too. The only real infrastructure required is electricity for them to work. So once we started getting into this, it turns out China actually produces about 90% of the world's oxygen concentrators. So in a matter of about 24 hours, we put a procurement team together with people on the ground in China to help us out with this. So we worked on specifications, and we had consultations with numerous medical staff and teams to find out what is the right specification to go after. And it turns out 5-liter or 10-liter, depending on certain things, both work. So we started procuring both of those. We made sure that all of them are hospital grade. We looked at ratios of oxygen concentration at different delivery levels for the different type of devices. They had to be 220 volt. And then, something as simple as the manual and the dashboard on the device had to be in English. It couldn't be in Chinese and things like that. So we had to make sure all these check marks were available on the device. We did face a bunch of obstacles initially. Number 1 was factory quality. All of the concentrators purchased by Pratham had to be European or US certified factories. So we went into and quickly had audits done of the factories to make sure the certification met up with US and European standards. Unfortunately, I'm sure you're hearing a lot of reports of fraud and low quality products have surfaced, but luckily we were able to sort through that through our audit process. Finances were an issue. Virtually all of the factories were looking for large advances or even 100% in most cases for the orders. So we needed to have people directly on the ground in China to confirm we're giving advances of 200 to 500 to $1 million to people we felt secured with. Chinese customs became an issue. There is a lot of bureaucracy in China to ship products out of China. So we figured out a system to move them to Hong Kong, which reduces that bureaucratic burden. But within Hong Kong, you have to have a warehouse to store these until an air freight option would be available. And then finally, we had to put together a lot of the paperwork needed. Our procurement team honestly worked day and night with numerous factories. And even I think Rajiv Sokti's on the line, and we worked with numerous factions of the Indian government next to see what we could do once we've procured the actual concentrators. So in conjunction with Rajiv and his work with the Indian government, we were able to get discounted air freight and charter options. And just remember, during this time, China banned flights from India directly into China. So our options significantly reduced. So it turned out it was all freight or charter options only. Our team was able to get customs duties waived for imported concentrators. And then we were even able to get GST waived. In fact, the Pratham concentrators were the first imported relief products that had the GST waived, both for just normal shipments of it, as well as interstate sales of the products. We were able to get those waived, which was a large savings and allowed us to procure even more product. So now we've brought the product from China to India. The next question is, what do you do next? Nishant will speak more about a lot of the dashboards we've put together for transparency and reporting of how the concentrators get distributed. And then the Pratham team, because we work in so many communities across India, rural and urban, we were able to easily find out where the need actually is. In fact, with our first set or not just our first set, with every set, we also have put together how-to videos of how to use the concentrator. And luckily we have our digital initiative out there with the tablets, so we can easily process the how-to videos through our digital initiatives, which helps the communities that these ultimately end up in. So ultimately, in less than a 2-week period, in conjunction with a couple of other charitable organizations that we work closely with, Pratham and these couple of other organizations, we've been able to procure about 13,000 concentrators. And just to put that into perspective, the US government originally sent over less than 10,000 concentrators. So Pratham and our partners have been able to actually far exceed what the US government was able to do. And also, to put numbers to it, we believe each concentrator can affect about or help about 10 patients per month. So if you work through those numbers, once we have the 13,000 delivered, Pratham will be affecting the lives of about 130,000 patients every 30 days that this pandemic continues. And that's just an amazing number that we've been able to put together. There's not too many times that in a matter of 2 weeks, you can save 130,000 lives a month. And the team on this phone call was able to do that. So finally, I'll also talk about, now that the first 2 weeks have ended, we've started facing new challenges as it relates to the procurement. First is capitalism in its rawest form. So traders from India, as well as Chinese entrepreneurship at its best, in a matter of 10 days, the pricing of concentrators has shot up 2 to 3x from their normal pricing. So that's something we've navigated our best through, but it remains an obstacle. The other thing is decisions have to be made within minutes, which doesn't sound like a big deal, but if you think about it for a second, we're all working on different time zones and at different times. So what will happen is a factory will call and say, I can give you 500 at this price, will you take it? And you have about less than 5 minutes to decide and wire the money. And that could be happening at 1 a.m., whether it's California or East Coast time. And the decision has to be made and funds have to be set up to go. So that's another obstacle we've worked through. The Chinese government is also lately threatening controlling all of the production and distribution of concentrators within China. There was a Times of India report on that. The Indian government is asking China to stop the gouging of prices. So we'll see how that goes. And now that we've procured it, we're finding out promise dates for a lot of other organizations have changed. So components and raw material shortages are happening in China. So what they may have promised to deliver late May is suddenly June 10th, and then it becomes June 20th and keeps getting pushed. So our team keeps navigating through that. So ultimately, I think everyone on the phone should, feel comfortable that our team in China and India and the US is working around the clock to put the best execution plan together. So with that, I'll send it to Jalaj, who can talk about our distribution plans within India.
Yeah, good morning to everyone. I've just put together a few slides to give you a context. First of all, I must say that it is an extraordinary effort from all of you in Pratham USA to put together both the funding and, more importantly, the supply chain in place. So the machines have started rolling in the last few days. So as far as we are concerned here in India as Pratham Education Foundation, we have tied up with the Piramal Swasthya. That's the health initiative of Mr. Ajay Piramal, who is also the chairman of Pratham Education Foundation. So we are working with a broad number of 10,000 oxygen concentrators, and we have between us, unfortunately, Rukmani and Ramesh are not able to be on this call today, but Rukmani, our CEO, and Ramesh, a fellow board member, we have formed a 3-member team as far as deployment of oxygen concentrators are concerned. And there's a lot of back-end work that is being done by the rest of the Pratham team. And you have Nishant here, but there are other members of Pratham also who are doing good work as far as putting together all the data and also navigating through all the approvals and ensuring that things don't stay at one place but keep on moving. So deployment will be done using services of credible NGOs, and one of the clearing and forwarding agencies also has been identified by Pratham USA, and they are also providing a lot of help as far as making sure that the last mile is something that is met as far as logistics is concerned. We will learn a little later about how we intend to do monitoring in the following presentation. Also, we will be regularly providing updates both to Pratham USA and Pratham Education Foundation teams as far as these 8 to 10,000 oxygen concentrators are concerned. We can move to the next slide, please. So, as I was saying, Piramal Swasthya is spread across 7 states in India, primarily Assam, UP, MP, Jharkhand, Bihar, Rajasthan, and Maharashtra. So they have requested 1,800 of these oxygen concentrators to be deployed across these 25 districts itself where they are working. We have a concept in India of what are called aspirational districts. These are districts that have been in some sense been neglected or not developed as well as the rest of the country. And there is a lot of work in these aspirational districts also that Piramal Foundation has been able to do. There's another organization which is called Project Mumbai, So they have taken the responsibility of about 350 oxygen concentrators to be deployed in Mumbai and in Maharashtra, and another organization in rural Gujarat that has already come up for 40 oxygen concentrators. Many more proposals, including some of you from the US, have given us leads. So we will be working with some of them from Uttarakhand, other parts of Gujarat, Andhra Pradesh, West Bengal, Tamil Nadu, as the time goes by. We can move to the next slide, please. So this is the process that we have published and we intend to stick to for the spirit of transparency. So step one is all the requests and assessment. So shortlisting for sharing is done with the selection committee. We want to ensure that we work with NGOs on the ground. So in different parts of the country, whether they are urban context or rural NGOs, we want to make sure that we work closely with them and ensure that these machines are distributed with the kind of expectation that any donor has, because we want to make sure that not only in this round these machines are deployed well, but even going forward, God forbid, if there are any more such rounds, then in those waves also we are able to deploy these machines. We can go to the next slide, please. So this is what has arrived already so far. So 500 of them arrived on 6th of May in Delhi, 12th, which is in the last one day, another 100 in Mumbai, and 250 have landed more in Delhi and Mumbai, which have been cleared today. And these again will be moving out starting tonight to tomorrow morning. And this have already been delivered, 500 of them in Delhi itself and 100 of them in Mumbai. So on an on-time basis, real basis, just like the purchase team that Raj talked of taking decisions, here we have a little bit longer opportunity to know how the supplies and where they are landing and what sizes. And we have both the sizes, and that's what we are trying to do. I just want to also spend a couple of minutes and talk about what else can be done as far as the way forward is concerned. So the leg one of the strategy, which was rightly identified by Pratham USA in conjunction with Pratham Education Foundation, was oxygen concentrators. And that's where we have done, I think, fairly good work. What is now required as far as India is concerned is a set of medical equipments. Some of them are quite expensive, and we also need to make sure that we have people on the ground who can deploy them correctly. So whether they are PSA plants, whether they are oxygen cylinders, whether they are pediatric ventilators, whether they are BiPAPs and high flow nasal cannulas, HFNC machines. Besides that, as you know, Pratham works in many communities, but also does a lot of work as far as skill building is concerned. And in the last few days, we are discussing with some other partners, whether it's installation of medical equipments, whether running of the medical equipments is concerned, maintenance is concerned, and also repairs. If we can create a team of people who can, throughout the length and breadth of India, with the training that they get from the vocational centers of Pratham, we can create a cadre of people, and somewhere that will be equally important. Definitely we need money, definitely we need equipment and medical supplies, but we also need human resource to deploy these things. Another thing that's being talked about, and I'm sure the supplies will improve as far as vaccines are concerned, and Nishant will talk about that next, is the whole awareness bit as far as vaccine is concerned. And as they say, there is the AHA as far as the vaccine is concerned, A being availability, H being hesitancy, and A being administration. And these are the three critical steps that have again been identified by the public health officials, and a lot of work Pratham can do as far as that is concerned. And last but not the least, as we work with a lot of community partners as far as Pratham is concerned in the 15 to 20,000 communities, whether it's the protective equipments, whether it's thermometers, whether it's oximeters and things like that. So some of the donations that we receive can also be used by locally procuring some things from India itself, because it's available, and ensuring it is distributed to all parts of the country. I'll just stop here. Thank you.
Over to
Over
Nishant.
to you, Nishant.
Thank you so much, Jalaj. First of all, I must thank everyone at Pratham USA for the tremendous work they have done and the quick thinking process to put together this effort of bringing in much required relief. As someone who has gone through some personal loss in this period and seeing everything around me, I definitely know that the efforts that are being put in by Pratham USA and the board members at Pratham India are definitely going to help a lot of people in India. And we are trying to make sure that we reach out to the audience that Pratham has typically been serving, which is the rural areas of India, the areas where typically people don't focus. I'll try to answer a couple of points that were raised earlier about the kind of data that we would be collecting and how we would sort of be tracking to ensure that the concentrators and the equipment that we are deploying is used to its maximum. So as Jalaj pointed out, that there is always going to be an intermediary NGO or an organization that will be in between the organization donating the concentrators and finally the facility that is going to use the concentrators. We are working with this particular organization or these organizations who would be in between to collect data periodically every month on how the concentrator itself is doing and how many patients have come in, how many patients needed oxygen in that period. But we are also looking at some metadata to see the impact of the concentrator that we are bringing in. The first thing is that we are looking at what we typically refer to as L2 beds, level 2 beds, which are beds which have got oxygen supply in them. What was the number that we had and where have we reached after putting the concentrators in? The other thing that we are going to look at is the case fatality ratio and the primarily to try and understand if we have been able to dent that. We understand that there are multiple factors that will be impacting that, but probably right now oxygen supply can be one of the important things looking at that. So we have set up a tracking team at Pratham, a team of people who are reaching out to these hospitals and organizations and collecting data every month. The idea here is to not overburden the healthcare facilities with data reporting and things like that, because we know their focus should right now be on serving the patients. That's why we have set up a team on our end who will be reaching out and making sure that whatever data that we need for reporting is collected. And simultaneously, we have also set up preemptively some mechanisms of repairing the concentrators if in case there are any issues that come up with the concentrators itself. So I think in the days to come, there will be much more details on how these are being used, and we'll be sharing that periodically. But once again, want to thank the quick thought that was put in and the efforts over the past couple of weeks to bring in much needed help. I would now actually want to switch to another need, which is probably going to help us avoid the third wave, as everyone in India is seeing that's going to come, or at least minimize the impact of it. And that primary need is awareness. And we are at Pratham, we are trying to come up with our own ways to the communities that we have reached in, the digital initiatives supported by the Sir Mangal Family Trust that we have started, and the content that we are creating, how all of that can be leveraged to make sure that we can spread awareness and make sure the impact of the third wave is taken down. So I have a couple of slides, and I would request them to be put up so that I can talk about some of the efforts that we have been doing. And I think we'll start with first a recap of what Pratham has been doing since, I think, April 2020. We obviously stopped all our on-field activities, but we transformed into this remote engagement way across our programs. We reached over 10,000 communities and collaborated with 600 plus partners on remotely engaging children and youth. And it was not just through digital means of WhatsApp messages or videos, but it was also through television programs, radio programs. SMS was a big initiative that we did. We reached out to the communities that we were serving directly, but all the effort that we put in creating this learning content, remote learning content, also helped around 14 state governments to take up what we have been building and spread it in regional languages. We transformed our vocational training model into a hybrid one. And we are quite proud to say that even during the pandemic, without a full-fledged center running, we had people doing remote classes and then practical sessions in the center, and then finally getting placed as well, which is a matter of great pride for us. Our internal teams have been adapting to the new normal, and a lot of new roles, new transitions in how people deal with this. Their role at Pratham has come up, and that, I think, the agility that Pratham people have is something that has helped us move a long way in what we are trying to do here. On to the next slide. Would just want to highlight what we are doing right now. So you have obviously heard about the efforts of Pratham USA of bringing in the concentrators. Pratham Education Foundation is helping Piramal Swasth in India as volunteers in terms of identifying where the needs are, in terms of helping with the tracking and ensuring that the delivery is right. At times also helping with a course on repairing oxygen concentrators and other things, so that there is a sufficient human resource to support this deployment that we are doing. The other thing is on the vocational training centers, where across 8 states, the facilities that we had as our vocational training centers, we are looking at transforming them into isolation facilities as well as COVID care centers. And all of this is being done in partnership with local healthcare partners. So we reach out to a healthcare partner in the vicinity of our center and give them a couple of options, like setting up an isolation facility, or if they have extra healthcare staff and need a physical infrastructure, we offer our own physical infrastructure to be converted into an extension COVID care facility. We are offering now the infrastructure to be used as a vaccination center as well. And all of this is being done in a distributed manner, where each of our centers are reaching out to local healthcare partners and adapting according to their needs. The third and the big one is the Karuna Apni Surraksha campaign. So this campaign is essentially a continuation of Karuna Thodi Masti Thodi Padhai, the campaign that we had running the last entire year, where we were focusing on let's do a bit of learning and a bit of fun. This time it's Karuna Apni Suraksha, where we are trying to focus on health messaging. Once again, we quickly switched into the knowledge that we had about communities and the kind of social infrastructure that we build in communities, to make sure that it's not just a broadcast of information, but also a feedback and dialogue, so that we can help them in getting over the misinformation that is reaching out to them, getting over the vaccine hesitancy, and a lot of other things that we are trying to do here. On to the next slide. Would want to talk about 2 immediate plans of the vocational training centers. We are converting the facilities into isolation centers, care centers, and vaccination centers. All of this is being done in partnership with government and healthcare services. We are also making sure that there is an outreach to communities in and around our centers to provide on-ground health awareness and to also enable access to equipment and supplies through the network that we already have. So at this point in time, across Pratham, all our programs are focusing on how we can help in this time of need. But the idea is to have specific solutions with the kind of facilities we have. So with Pratham Institute, the vocational training arm of Pratham, we are trying to focus on leveraging the spaces that we have. The next one is about Karuna Apni Suraksha and what we are doing on that area in the next slide. So there are 2 things that we are doing in the immediate term. The first is SMS and WhatsApp campaign. These are going in 11 languages to 20,000 communities. And once again, it builds on what we already knew about a family connect, a mohalla connect, and then a community connect, to make sure that it's not just a broadcast of messages, but a 2-way dialogue. we have content partners like Noora Health, Public Health Foundation of India, Abhivyakti, Mukta Charitable Foundation, and Menstrupedia as the arm that we develop the content with, so that there is verified medical information that we are sending out to the communities. The other is continue connecting to the children, families, youth, and communities. And to go beyond delivery, we are using discussion platforms to allow for ongoing feedback. We are building trust and relationship like we always have. And the focus is on gathering the kinds of questions that are there in the field and reaching out to our healthcare partners to get answers for that. One of the most important things right now in rural India is to answer or to tackle the misinformation that is going around in loads and loads over different social media platforms and so on. One of the challenges that we see is that there is not enough fact checking happening in regional languages. The Press Information Bureau and a couple of other government websites are definitely putting out a lot of fact check, but in a only in limited number of languages. We are trying to take that up and convert it into multiple languages and send it out through our channels, and also make it available for other organizations so that they can use this messaging service. They receive the message and then they can send it out to their constituents as well. And that is the Karuna Apni Surraksha immediate plan that we are executing right now. On to the next slide, I think we have a couple of snippets of the webinars that we are doing right now. So we have already started these webinars where we have got the healthcare staff from the vocational training arm that we trained in partnership with our healthcare partners to make sure that they can deliver relevant information on COVID awareness, but also gather these questions that we later send out answers to over WhatsApp messages. There are 250 plus such webinars that are being organized, and we are reaching over 11,000 communities right now, and the plan is to expand it much farther. We are doing it in 5 languages, and each webinar has got 60 to 100 community members. And typically we have got the village head, who's known as the Sarpanch. We have got community members, youth network volunteers, and others joining in the webinar and asking questions so that there is someone that they can talk to. The next series is actually planned with doctors, and we are reaching out to various organizations to have doctors organize these webinars so that they can talk about some of these things. I think it will be a good idea to maybe show a video where of some of these webinars, and you will get to hear the kinds of questions that come up. And I have been on various such webinars and interactions where the questions like, is non-vegetarian food a cause of spread of coronavirus? Should girls and women take the vaccine during their period? How do we recognize if anyone has got COVID? These are the kinds of questions that we get on these webinars. We have trained our team, equipped them with FAQs and answers to these questions, but are also assimilating all these questions so that we can have much more effective fact-checking answers sent out so that the awareness side of things is taken care of. With that, I would request to probably play that short video on what we are doing with the webinar campaigns. And with that, I would give it over to Deepak. I'm sorry, I think
थोड़ा सा बुखार हो जाता है तो लगता है कि अब हम कोरोना से पीड़ित हो गए।
को बीमारी है तो वैक्सीन लगवाए या नहीं?
घर या मोहल्ले में सैनिटाइजर करने से वायरस मर जाता है। अगर मर जाता है तो कितने दिन का गैप देकर सैनिटाइजर करना चाहिए?
अनमेरिड गर्ल्स को वैक्सीन नहीं लगना चाहिए, ऐसा लोग कह रहे हैं।
डरना नहीं है, सावधान रहना है। पॉजिटिव सोचें और पॉजिटिव होने से बचें। आज ही हमारे साथ व्हाट्सएप पर जुड़िए। इस गूगल फॉर्म को भरो ना और करो ना अपनी सुरक्षा।
Thank you.
Great.
I think I have taken a lot of time, and I would give it over to Deepak now.
No, thank you, Nishan. That was very helpful. And I tell you, I mean, there's so much work to be done on the ground in India. So thanks for all that you're doing. And thank you, Dr. Mangala, Raj, Jaraj. Thanks for all that you are doing. So we have a lot of questions. And I think we have about 10 minutes. So why don't I just ask 2 or 3 questions, and then please rest assured that any questions that you ask will be answered by the staff, after the webinar, in the event we don't get to them. So let me start with Dr. Mangala. Is it okay to call you Dr. Mangala?
Mangala is fine too. Yes, absolutely. Yes.
The issue in India, obviously the cities are there, Delhi and Mumbai, which have been huge problems, but it looks like that this rural area is just, in very, very difficult shape. Do you have any suggestions, any thoughts on what can be done in these rural areas? And given Pratham's infrastructure, if we can be helpful in that?
I think education, which is what you're trying to do, in a way that is familiar to people, WhatsApp and things like that in their own language, I think is the key. Educating them as to what COVID looks like, what the symptoms are, and when they should get help, and not wait too long, I think is key. So you seem to be doing that already. I'm just going to turn my targeting that population and doing all those things. So you're on target. You're doing, I think, setting up facilities where people can go, and not just have them waiting outside hospitals that don't have space for them. We know the infrastructure of these hospitals is not enough. So setting up, field facilities where people can go for help, even if they're not very, very sick, to answer questions, to get oxygen concentrators, that will save lives.
Great. So we seem to be on track to do what we can. Obviously, the needs will evolve, and we look forward to continuing conversations on this topic with you and seek your guidance. I think that's great.
And one last thing, vaccine administration, helping anything we can do to get those vaccines in people's arms as fast as we can. That will prevent the ongoing spread of this. So our efforts also need to be focused on that, as well as saving the lives of people who have it now.
Yeah, I don't want to get away from the subject at hand. But,
yeah, sorry. Yeah.
But one other thing that we are doing, as you might know, and a lot of our Pratham people are involved in that in the US, in terms of board members, is on this whole advocacy idea. Ultimately, obviously we all are doing what we can, but government resources are unlimited, in many ways. So in fact, we are pushing quite a bit on this whole vaccine idea, because I think there'll be excess vaccines in the US
Yes.
As we speak. And so I think there's a lot of work to be done there. So, but yeah, thank you for that. Jalaj, if I can turn to you, there are a lot of questions about all these stories on black market and misuse of concentrators and other equipment in India. Can you just spend a few minutes talking about how are you and the team ensuring that does not happen, and to have good transparency, in these distribution channels?
So there are, if I may say, 3 ways we are looking at it. First is Pratham Education Foundation itself has lots of relationships as far as various communities around the country is concerned. So we want to work with certain NGOs that Pratham Education Foundation identifies in those communities, and ensure that not only now, but 3 months, 6 months, 9 months down, also these machines are always put to good use. Second is the partnership with Piramal Swasthya. they are a fairly large organization as far as rural medical delivery is concerned. So whether it's telemedicine to many other things, they have fairly evolved models. So there are many parts of the India we will work with them and through them to ensure that whatever help that goes out from Pratham USA is put in the right hands. And again, monitoring and evaluation will happen as far as that is concerned. And third is, we are still looking. We have found a few, but we will keep on looking. And that's where some of the Pratham USA members have also written to some of you and some of us. We will work with certain NGOs that are credible, that have governance in place, that have dashboards which we can work with. And we want to ensure that even when we work with the government, there is a layer of implementation partners, which are the NGOs, because it becomes very difficult to say no to government. But few months down the road, we will not really know where our assets are. So if we can work with a set of NGOs who in turn engage with these government hospitals, because as far as rural India is concerned, that's where most of the Indians go. Even in the urban context, there are a lot of municipal hospitals where there are many patients who are going. So we have identified and we have rolled it out slowly, and we will be doing a lot more as far as these NGOs are concerned. So combination of all this, we are not going to give a single machine to anybody or 10 machines to somebody just who shows up, because that's, I'm sure, not the desire of any of the donors also. We want to work, as I said, with the Pratham education community partners, with Piramal Swasthya partnership, and with a certain NGOs that are credible.
Thank you, Jalaj. Nishant, do you want to add to that? I mean, you are putting together the tracking mechanism to provide transparency. Where are we in that process, and what would it look like? How would you track?
Sure. So I think the tracking itself starts from the first point of figuring out the needs. And because most of our board members, including Jalaj and Ramesh and others, are involved in a lot of efforts supporting various organizations with the needs of oxygen concentrators. So a lot of need comes from them. But we also are looking at the data in terms of the case fatality ratio and the positivity ratio, right at a state and a district level. And then with that, we are targeting what districts we should be focusing on. And in those districts, we try to either find a credible partner that we already know about, that are in the network that we have been operating in, or through the network that Pratham Education Foundation has on the ground. We try to leverage the need or identify the need that is there. Once the need side of things is done, we then move on to making sure that the shipment comes in. There is some documentation that has to be taken care of. After all those processes are done and the shipment is actually delivered, and the agreement between Piramal Swasthya and the receiving organization is completed, we put a tracking team from Pratham side, which reaches out to these organizations where the deployment has been done periodically. And there are 6 data points that we have asked them to collect every time, every month. And the idea here is to not increase the burden on the side of the healthcare facility so that they can focus on their important work, but rather be calling them up and collecting the data once every month so that we can get how the concentrators are being used, how helpful they are getting to be. And then I think as the results show up, we'll see them in these indicators of CFR and others as well. And that's what we are hoping for. The dashboard, I think, is something that we will have ready after this initial deployment that has just happened. And in the next few weeks, we'll have that sent out for people to see.
Great. Thank you for that. And Raj, I don't know what to ask you, my friend. I mean, this is what you have done is just so incredible. But as you look ahead, you know, and the needs might change, you know, from concentrators to other things, you know, as this develops, is there an opportunity for us to do other products as well, you think, you know, beyond concentrators as we move forward, and to leverage this great supply chain that you have put together?
Yeah, I think there's absolutely opportunity to look at other products now. In fact, as it relates to concentrators, that situation is somewhat stabilizing. So in fact, this morning, a group of Pratham supporters had a call to see what's next. And so the good news is we're using real-time data from the ground level to figure out what's next. And from there, we'll use the supply chain as required to procure the right products.
That'd be great. And, I know Raj mentioned this already, but we were fortunate for this process that Rajiv Sopti, one of our dear friends, was in India at that time, and he worked very closely with the government to help out as well. And quite a few government officials were quite helpful, in this whole process, including the Consul General in Hong Kong, right? I mean, she helped out in air freight shipments and so on and so forth. So we appreciate, all the work that has gone behind this from them as well. In terms of the vaccines, maybe turn to Dr. Mangala for that. What do you think is the right path here, as we go forward? Clearly, I mean, ultimately the goal has to be to get as many people vaccinated as possible. Pratham will help out, in the education, for that. How much time do you think it might take, to logically be able to vaccinate, this huge country, and to get this virus under control to some extent?
I am hopeful that the steps that are being taken right now to get things under control will start to work. We can already see that the peak numbers have stabilized a little bit and are not rising, which is the first sign that things may start getting under control. I think vaccination is the way from happening, is to vaccinate people. What is happening now is the virus is left uncontrolled and can mutate, and other variants can pop up that are more dangerous and more deadly. So to control the virus is key, and to prevent further spread of this. So I think it's a joint effort. It takes a lot of effort to vaccinate people, to set up those mass vaccination sites, to have vaccine available. That is a big effort, but I think that is the key to prevention of further harm. So I think it's a joint effort of controlling what is happening now and helping those people to get better, controlling what's happening in each person's house so that the spread is limited, and then controlling the next steps of getting people vaccinated. So it's a very labor-intensive thing that is going to be difficult to accomplish. But in India, more than anywhere else, we're able to do things like this, come together as a country and support. So I have hope that this will be achievable and doable. It's just organization and supplies, getting those vaccines to India or made in India as fast as we possibly can. So all of these efforts that you guys are doing will help India accomplish this, and there's no doubt that they can do this. They have labor, they have educated people that can pull this off very easily. So just getting supplies to them is what we need to do, which is exactly what you guys are doing.
Great. Well, listen, thank you so much to all of the panelists. Thank you to everybody else for joining us. You have heard how Pratham swung into action, and this was only possible because of support from you. Our board members and donors have given above and beyond their usual commitments, and we are grateful for that. And we have many donors who joined us for the first time, and again, that is terrific. I think we've done something unique here. Obviously, many NGOs are helping, and it is great that many NGOs are doing what they are doing. But I would say that in terms of the supply chain, in terms of the distribution that's been put together, there are some unique things that have happened here at Pratham. And it is thanks to the efforts, of all our team members and our board members that you heard from today. The need is continuing. So, please help, please donate. And I hope that we have given us you enough sufficient reason in the past hour to choose Pratham. Our commitment to you is that we will be careful stewards of the funds that you give us. We will be totally transparent and accountable on how we spend them. And this is not just for COVID relief, that is the values that Pratham lives by. And so we will continue that tradition. So please, keep that in mind as you make your decisions. We shall do more webinars like this, and we will email you progress reports as we go on. So, and we all want the pandemic to abate as soon as possible, and for some semblance of normalcy to return for our brothers and sisters, in India. And when that happens and schools reopen, please rest assured that Pratham will be there, back, attending to our core mission of every child in school and learning well. So thank you very much for all your support, and we look forward to our next session here. Thank you.
And Deepak, in case we were unable to answer any questions which had been posted today, we will respond to all the questions and send them to the attendees. Again, thank you for joining us today, and thank you to the panelists for your time. We truly appreciate it. With gratitude, enjoy your day, and thank you for joining us today.
Thank you.
Thank you.
Thanks.
Thank you.